Policymakers, doctors and global health experts have converged in New Delhi for WION's Health Pulse Summit. Here is an excerpt from the second session, which focused on artificial intelligence and digital integration. Take a look.
Dr. Harper, do you have patients who are coming into you, with diagnosis from ChatGPT, convinced that they've figured what the problem is, what the cause of the solution is, and how do you tackle people like that?
Okay, coming back to the first statement you'd made about that study, 74, 76, and 90%. Those doctors, unfortunately, I don't think they had OC. AI is artificial intelligence. OC is original common sense. Just add those two together, those numbers will go up dramatically. You'll probably get 98 or 99. I look at AI like umpire's call. If it's hitting the stump a little bit less than half the ball, it's still umpire's call, it's out. But there's some human aspect to it. But unfortunately, we don't have only 2 or 3 DRS reviews in our OPD. Everybody, infinite DRS reviews, everyone comes with a DRS review, and it becomes problematic. And our OPD consultations go longer and longer. I'm sure Sir also would agree with me, and many of the other doctors in this August gathering would have had this meme passed around that doctor consultation alone 500, Google plus Google 1000, AI please come after 3 months with 3,000 deposited pre.
When we integrate robotics or AI with surgical parts, so what AI is doing, we're doing pre-operative CT scans for our patients, which we are not doing when I'm doing a conventional surgery. So a robotic surgery implies that you do a CT scan. That CT scan, we get a 3D segmentation of the scan. We get a 3D bone model before we actually do the surgery. And on that model, we do sizing of the implant, what size of the, for example, for the hip replacement, what size of cup, what size of stem will fit the patient. We do know that before we start the surgery. And we do a virtual surgery on the computer before we actually doing a surgery. So some patients ask me, the doctor, I've suggested a robotic surgery, and they come, doctor, if robot is doing the surgery, what are you going to do? They think that the surgeon is going to sit and have tea in the corner while the robot is operating. It's not like that. The surgeon himself is in total control of the surgery.
So I mean, today when we are in this era where everything is so cookie cutter when it comes to diagnostics, it's something that we genuinely lost sleep over. And of course, AI and technology was a great example on how we circumvented that. And of course, I've always believed that I would like to conclude by saying AI should be E4 to make health P4. So your AI should be E4, the 4 E's stand for ethical, equitable, evidence-based, and explainable. For health to be P4 is personalized, preventive, predictive, and participatory. So I mean E4 for P4. I mean, that is my moral of the story.
Dr. Naik, do you think that possibility can ever materialize where AI can completely replace a doctor? I know it'll probably replace me first. Journalists would be gone, but doctors, do you think perhaps would be the last in line?
See, I don't think so. We can see a condition in which AI will be completely autonomous, and a robot will be able to completely supplant a surgeon, and the surgeon need not be there. That would be fictitious, because there are many things that need a human intervention. And although AI, the robot can certainly help assist performing tasks, but we have certainly not reached the stage where they can become completely autonomous and completely perform surgery without any human intervention. But we should realize that AI is a tool that has to be employed after using it's a correct basis. Because there are umpteen examples where AI can cause hallucinations. AI can fictitiously bring out diagnoses and suggestions which are completely incorrect. So you cannot completely depend on AI, because AI comes from a whole lot of sources. Remember that health information is information that if it has to be used for generating any sort of background knowledge, it has to be from medical journals.